These must be properly identified by organizations before they become significant problems. Now, as a result, it's critical that critical experts understand the steps involved in developing proactive strategies for identifying and evaluating cybersecurity threats before they materialize into real problems. In light of this, good morning to all of you. My name is Chuma Felix, and today we'll discuss the Augusta Medical Hospital cybersecurity framework. But first, let's take a closer look at the Augusta Medical Hospital overview. Now, the mission, vision, and values. Now, our main goals of Augusta Medical Hospital are research, teaching, and patient care. This implies that we provide cutting-edge medical professionals, innovative research, and the newest innovations to you here in Augusta, Georgia. Now, our mission as a student-centered comprehensive research university and academic health center is to lead and excel in teaching, discovery, clinical care, and service while offering a wide range of programs from learning support to postdoctoral studies. Now, guidelines for managing and lowering the security risk associated with IT infrastructure are provided by the NIST Cybersecurity Framework. Now, the CSF is a collection of policies, procedures, and standards that can be applied to stop, identify, and handle cyber attacks. Now, the CSF, which is Cybersecurity Framework, was developed by the National Institute for Standards and Technology, NIST, to assist private sector entities in the US in developing a critical infrastructure cybersecurity roadmap. It is utilized by several governments, including Israel and Japan, and has been translated into additional languages. Now, the NIST CSF alignment offers a comprehensive manual for inexperienced users. It also permits customization of security measures, and also it does not impose limitation on the manner in which the business satisfies standards, and it enhances cybersecurity posture. Now, stated differently, the goal of NIST CSF is to support an organization that must safeguard critical infrastructure, just like the Augusta Medical Hospital. Now, the following are some ways that this framework can be used to improve cybersecurity. Now, it helps what to build a profile in order to ascertain the extent of cybersecurity standards and what that helps in safeguarding different information that are in place. To determine potential new cybersecurity guidelines and regulation, to convey any updated criteria, and also to develop new guidelines and a cybersecurity program. Furthermore, it is crucial to remember that the NIST CSS 5 primary rules are to identify, protect, detect, respond, and recover. In other words, the alignment also provide what system and hardware inventories, and also make sure that the organization are what correct. Information systems from outside sources are indexed. A cybersecurity policy for the organization is created and also what shared, and it also contains risk assessments in the alignments. And most importantly, the impact and likelihood of vulnerabilities are identified. Now, a vital component of the healthcare sector is regulatory compliance, which is ensured by a number of laws and rules such as HIPAA, OSHA, FWA, and general compliance requirements that guarantee high quality care. These rules are designed to enhance operational efficiency while eliminating fraud, waste, and abuse, safeguarding worker safety, and also what preserving patient privacy. Now, the following are a few of these regulatory requirements. We have the HIPAA, Health Insurance Portability and Accountability Act of 1996. HIPAA compliance includes adhering to the security and privacy regulations, notifying parties of breaches, and enforcing the rules to safeguard data from the healthcare system. All healthcare providers are subject to the HIPAA privacy rule, which covers oral, written, and electronic media. In addition to requiring disclosure of the information's usage, it gives patients the right to access their protected health information. In an ever-changing world, healthcare facilities must likewise update their security protocols to protect patient information. We also have the anti-kickback statute and stack law. The purpose of the anti-kickback statute and the stack law is to protect patients' rights to an independent medical opinion from the effects of covert financial agreements between hospitals and healthcare providers. Excuse me. These restrictions are necessary because financial incentives that are not acceptable can result in medical decisions that are not the best ones and higher costs for Medicare and Medicaid services. Now, we also have the Health Information Technology for Economic and Clinical Health. Now, this act strengthens two important efforts. It supports HIPAA enforcement efforts and encourages the appropriate use of electronic health records and cybersecurity safeguards. Public health inefficiencies result from the small number of hospitals that implemented electronic medical record systems prior to the High-Tech Act. The goal of High-Tech was to promote greater use of electronic health records while protecting patient confidentiality and security. We also have the Affordable Care Act. Now, the Affordable Care Act seeks to reduce healthcare costs by encouraging innovative approaches to the delivery of medical care and expanding access to health and insurance coverage for a larger population. Pre-existing condition denials by insurance companies were prohibited by the Affordable Care Act, which also established the health insurance marketplace. We also have the medical necessity, in other words, medical care based on need, making unnecessary health care unjustified. We also have some like the chain of custody, which basically describes the process that guarantees that a biological specimen is always in the care of someone who is legally obligated to preserve the integrity of the sample. Others will include the PCI DSS, and also the OSHA, which is the Occupational Safety and Health Administration. Now, upgrading absolute equipment and information systems since 2000 is one of the organizational initiatives. In stating this, the following are the organizational initiatives and business requirements. We have provide patients with an easy to use dashboard where they may do various tasks using their laptops and mobile devices. Make cybersecurity investment a priority. It is necessary to correctly integrate new medical systems with those that are already in place. Computers, both mobile and stationary, in other words, both for documenting and research purposes, must be taken care of. Traceability and appropriate security are prerequisites for electronic records and protected health information. Through the internet, patients can access their medical data, which include their history, current diagnosis, and treatment plan. To do all this, a patient portal is to be created. Additionally, a secure framework for staff and patients is another endeavor undertaken by the company. In other words, it's also managed by the CISO. Also, developing an informed and well-organized cyber team and providing staff training are two examples of corporate initiatives. Furthermore, facilitating access to medical claims, radiology, pharmacy, and laboratory systems, as well as staff efficiency processes through medical training, helping as necessary with the safe transmission of electronic health records to other healthcare providers. Viewing medical imaging and a major security improvement are all requirements for businesses under this organization. Now, other business requirements include having access to network integration capabilities, software programs, and current hardware. Cyber threats and vulnerabilities include ransomware, and these basically affect, or should I say, the effect of ransomware is the leakage of private information and the delay in patient care. We also have outdated system, hacking medical devices, which what causes endangering of patients and supply chain issues. We have vulnerable patient data and outdated system training. By employing several strategies such as refraining from paying ransom, maintaining hard drive backups, updating security software, providing employee training, and creating recovery plans, we may control these several threats and vulnerabilities. Other examples also include antivirus, email security, and DNS. Now, that being said, the following are other specific components of cybersecurity risk. We have employee. Now, the largest problem hospitals frequently face is the unlawful sharing of information, which is typically carried out by staff members. We also have the portal patient website, which is basically the website that is being made for patients in the hospital. If this website were made, it would need to have outstanding security. We also have the data organization and security category. Arrangement and comprehensibility of information are necessary to enable patients to evaluate it. At the same time, a mechanism for restricting access to the patient and appropriate medical personnel must be found. Furthermore, phishing attacks involving IoT and medical devices and third-party vendor risk are further cybersecurity hazards. By correctly teaching staff members how to spot phishing emails, organizations can also reduce the likelihood of such assaults. They can also use cloud-based data automatic backup and keep continuous and full visibility over all entities. This will truly help mitigate the different cybersecurity risk in the organization. Now, limiting access to only necessary end users, data accuracy, documentation of consent of collection, which is basically use of information, transparency with clients and customers, only collecting what is necessary, storing data on secure servers, technical safeguards, and consistent training efforts are some of the ways the organization incorporates privacy principles as they relate to data collection, disclosure, and retention. Now, the following are a few more privacy guidelines that Augusta Medical Hospital adheres to comprehend the purpose, vision, and guiding principles of the organization, to ascertain the target and present profiles. Now, according to Augusta Medical Hospital's current profile, the facility has experienced multiple cybersecurity problems. The target profile increases cyber mitigation and prevents these attacks by investing in technology to safeguard medical data and improve overall security. So keep an eye on the process of switching from current to target profiles by regularly evaluating and making necessary improvements to Augusta Medical Hospital's privacy posture. Additionally, some more guidelines about privacy are as follows. We have the HIPAA once again. We have the privacy of medical and sensitive information. Now, information covered includes all medical records from the past, present, and future. It also includes information about healthcare delivery and any payment-related data. And lastly, we have the PCI DSS, which helps to protect the cardholder information when making an online payment. Now, patient care is neglected. Certain restrictions make healthcare organizations work harder. Now, there is a lack of information about compliance with the constantly changing regulations, and the system is costly as a result of legal and regulatory standards. The following are additional effects of legal and regulatory norms on the system in question. We have balancing efficiency and quality of care. It is imperative for healthcare institutions to guarantee everyone access to the most fundamental degree of care, to preserve the integrity of the data, recognize dangers, and take strong security measures to thwart them. Also brings a new light in the impact of legal and regulatory standards on the given system in the organization. We also make part of this is to defend against the improper and unlawful use of disclosure of data. It also includes the risk mitigation and also increasing strict regulations. Like next, the patient portal could be created using a risk-based approach to cybersecurity. If staff members receive the right training, penalties and legal troubles can be avoided. All of these are what impacts of the legal and or should I say regulatory standards of the given system. Please, if you have a question, you can ask. Thank you.